right, the last two exercises or types of exercises that we're going to talk about is our hips and our ankles. If we have issues with our hips or ankles and there's poor mobility there, it can also cause low back pain and hip pain and knee pain, because when you have a lack of mobility somewhere else has to basically help. So if you're at your desk, a seated version is going to be our figure 4 stretch. You're going to take one leg, cross it over like this. To get a little bit more of a stretch, you're going to push down gently and lean forward. Push down, lean forward. So we're not like this. We're hinging at that hip. You can hold that one for about 30 seconds, and I would do 2 sets on each side. So that's our seated version. If you're someone who is very active, you're a golfer, you're able to get on and off the floor, my favorite version of this is the 90-90, or the hip drop on the floor. So what you're going to do here, you're going to have feet about shoulder width apart, knees bent. You're going to drop legs down to one side, rotate, drop them to the other side. So we're working on hip internal and external rotation here, making sure that hip is nice and like lotioned up. We talked about motion is lotion. Good. Okay, so those are the ones I would add for the hip. The last one we're going to talk about is going to be the ankle mobility. This one, if you have poor ankle mobility, it can also affect your squats if you're someone who likes to lift. The big thing I'm looking for with this one, I'm going to rotate the camera just a little bit to this wall. What I'm looking for here is we're going to have foot. We're going to have foot. You can just pick a spot first. This back leg doesn't really matter what we're doing. We're going to try to lean forward, get that knee to touch the wall without this heel coming up. So find that sweet spot. So if I brought my leg way back here and I try to get my knee to touch the wall, you see how my heel comes up? So that means I need to move my foot a little closer. Okay, heel came up a little bit. Let me move a little closer. Perfect. So that's a good spot for me. From there, what we're going to do is we're going to work mobility-wise here. So we're going to move in and out of this range of motion, trying to keep that heel down the whole time. Now, I don't want this to be painful, so if it's painful, just move toe up a little bit. Biggest thing that we're working on here is getting a little bit of stretch in the calf and gastroc, but also making sure our talus is a joint in our foot, that it is, or in our ankle, it's gliding as we're moving that knee forward. That can also be a limitation as well.